The basic principle behind Medicare is that the health of a citizen should not depend on their wealth. That was Bob Hawke in 1984, a simple sentence that reshaped this country. Before Medicare, your bank account decided whether you got to see a doctor. If you were sick and didn't have enough money, you went without or racked up debt. Introduced by a Labor government with a simple belief: healthcare should be universal. It's hard to overstate what a difference it has made. People got the care they needed when they needed it, and for the first time in our country's history, health became something the system helped with, not something it punished you for needing. But let's be clear, Medicare didn't survive this long by accident. Every step forward has come from Labor governments, and every attack, every freeze, every cut has come from the other side. In my community of Leppington, we're seeing the difference a government that genuinely believes in public health can make. Labor has introduced urgent care clinics. These care clinics are open 7 days a week, operating with extended hours and a fully bulk billed. You don't need to wait hours in an emergency department for a minor fracture, an infection, or a sick child. And you definitely don't need to pull out your wallet. This is the work of a government that believes in public health, not just in words, but in funding, access, and outcomes. Strengthening Medicare, lowering out-of-pocket costs. Building services close to where people actually live. The alternative? Funding freezes, bulk billing incentives slashed, talks of co-payments and user pays, shifting more of the burden onto hard-working families. Medicare didn't just happen. It was built, piece by piece, clinic by clinic, reform by reform, by the Australian Labor Party. Labor made Medicare, Labor strengthened it, and Labor will keep fighting for it because the job's not done. The question in this upcoming federal election is simple. Do we want a healthcare system that treats you when you're sick, or one that asks if you can afford it first? I know where I stand.